Good afternoon, good evening to you all. Today our discussion is on aortic stenosis. Aortic is a type of valvular heart disease. In the previous two lectures, I have discussed about the valvular heart disease in general, and the next second class was on mitral valvular heart disease. So today class is on aortic valvular heart disease. And as we all know that the type of valvular heart disease, all types of valvular heart disease is actually two types of pathology is there. One is stenotic type of pathology and the other is regurgitation type of pathology. So today we'll discuss the stenotic type of aortic valvular heart disease today, and inshallah next day we'll discuss about the aortic valvular heart disease on that is aortic regurgitation type of aortic valvular heart disease. So about the when discussing about the aortic stenosis, so if we go through some case reports, I think it will be easy for you to understand and to memorize this aortic stenosis easily. I think it will be easy for you to for better understanding of aortic stenosis. So this is the case report number 1. If I say a 63 years old gentleman presented several times of syncope with shortness of breath on exertion for last 2 years and increasing intensity for last 3 months. On examination, his dyspneic pulse 128 beats per minute, a small volume, BB 90 or by 60 milliliter mercury. Respiratory rate is 32 per minute. Of actually valve replacement, and patient underwent TAVI, and now he is doing. So if we consider this case as part by part, from the presentation of the case of aortic stenosis to the treatment of the case. So what are the information we are getting from this case report is that the patient, what is the age of this patient? That is a 63 years old gentleman. That means the aortic valve disease like aortic stenosis can occur in an old age person, that is in the latter age group, and it may also occur in the younger age group, and it may occur in the patient with middle-aged man. So when we consider the pathology of aortic stenosis or pathogenesis of aortic stenosis, then we actually will know actually which group of patients or which type of aortic stenosis is affected by which group of patients or which age group of the patients. It will be better to understand or to memorize. First, if we say that if a patient present with in younger age group, patient presented with aortic stenosis, that is patient presented with shortness of breath on exertion, or patient may present with syncope, or patient may present with chest pain on exertion. And in that case, it may be due to congenital heart disease. That hello.
Ji sir, apni visible sir, apni
আমি কন্টিনিউ করি তাহলে হ্যাঁ ওই যে আমার মানে নেটের ঝামেলা হচ্ছিল একটু নেট অটো চলে গেছে চেষ্টা করে আবার ইয়ে হলো হ্যাঁ তাহলে আমি আবার শুরু করি ঠিক আছে
জি স্যার স্লাইড শো করে দেন
আচ্ছা স্লাইড শো দিচ্ছি ঠিক আছে
জি স্যার
তাহলে যদি আমরা কনসিডার করি যে একটা পেশেন্ট যেটা আছে যে অ্যাওর্টিক স্টেনোসিসের রোগী আসলে কখন কখন অ্যাওর্টিক স্টেনোসিস বা কখন কোন ধরনের প্যাথোলজি হলে কোন বয়সে সাধারণত প্রেজেন্ট করতে পারে সেই ক্ষেত্রে হলো যদি কোনো একটা ইয়ং পেশেন্ট আসলে আমাদের এখানে অ্যাওর্টিক স্টেনোসিস নিয়ে আসে তখন ইন দ্যাট কেসেস we may think that may be a case of congenital aortic stenosis, and in that cases congenital aortic stenosis, when considering congenital aortic stenosis, usually bicuspid aortic valve is the commonest cause of congenital aortic stenosis. So bicuspid aortic valve and there may be even supraortic membrane or subaortic membrane that may be presented as like aortic stenosis in the young age group patients. So when we consider when we actually deal with a patient with young age group patient with aortic stenosis, then we must think we must keep in mind that this may be a case of congenital aortic stenosis due to bicuspid aortic valve. So we should consider bicuspid aortic valve always in a patient with the younger age group. If a patient present in the middle age group, in that cases, it may be due to rheumatic heart disease. So rheumatic heart disease is the most common cause of aortic stenosis, especially in the middle age group. And if a patient came in the elderly age group, in that cases, this may be due to degenerative cause, and this degenerative cause is due to aging process. There is a calcification of the aortic valve, and there is a degeneration of the aortic valve, and that may lead to the development of aortic stenosis, and also there may be associated with aortic agitation also. This patient may have also aortic agitation due to non-cooperation of the valves. So when considering the age, so if a patient present in the earlier age group or young age group, it may be due to congenital cause, and usually bicuspid aortic valve is the commonest cause. And if in the middle age group, rheumatic cause, rheumatic fever, or chronic rheumatic heart disease is the commonest cause of aortic stenosis in that age group. And if a patient present with আবার শুরু করি নাকি?
জি স্যার, শুরু করেন স্যার।
Sorry for interruption, and just due to maybe some technical and Wi-Fi connectivity defect, the Wi-Fi connectivity. So sorry for the interruption. And
slide show করে দেন।
Slide show this. So when considering the age, so we have already discussed the age, importance of age during a presentation of a case of aortic stenosis. And how the patient with aortic stenosis may be present. And so in that cases, usually the shortness of breath as a important cause of presentation in all cases of valvular heart disease. It may be in aortic stenosis, or it may be in aortic regurgitation, or aortic valvular visa, mitral valve, or any type of valvular heart disease. And shortness of breath is the most common presentation. And the other way of presentation, our patient may present with syncope, and as there is aortic stenosis and there is a low output syndrome, that is a small amount of blood is ejected through the narrowed aortic valve. So there may be a patient may go into syncope, and even there is maybe low blood pressure in the cerebral at the cerebral level, and so there will be reduced blood supply to the brain, and the patient may go into syncope. So aortic stenosis or pulmonary stenosis may be a cause of the syncope in some cases. So patient may present with syncope, shortness of breath, and even patient may present with chest pain. It may be on exertion, or the patient may experience chest pain even in the on rest. So the patient may present with usually these three symptoms. Even patient may present with other complications, like patient may present with features of heart failure, because as patient as with the severity of the aortic stenosis, the patient may experience hypertrophy of the myocardium, and eventually may lead to the development of the heart failure in case of patient with severe aortic stenosis. Or patient may present with complications like infecting myocarditis also. So these are the way of presentations of a patient with aortic stenosis. So what are the common presentations? So shortness of breath, syncope, and chest pain. These are the common presentation of a patient with aortic stenosis. And and what are the physical findings usually we get with a patient with aortic stenosis? So physical findings at first, actually on general examination, if we examine the pulse will be low volume. So low volume. Why the pulse is low volume? The pulse is low volume because there is a small amount of blood ejected from the left ventricle to the aorta due to through the narrow or stenosis aortic valve. So pulse volume will be narrow, and even it may be slow rising pulse, as there is a ejection of blood through the stenosis aortic valve for prolonged period. So there is maybe a slow rising pulse in case of aortic stenosis. So in case of aortic stenosis, we may get slow rising pulse, we may get low volume pulse, Even on examination of the blood pressure, a patient may have low BP, as in case of in this patient, we see that patient had blood pressure 90 or 60 millimeter mercury. So the pulse may be small volume or low volume, and blood pressure maybe hypotensive patient may have low blood pressure due to low output, cardiac output, low output syndrome. And then on examination of the PCRM especially, what are the special findings or specific findings we can get with a patient with aortic stenosis? On palpation, usually we get a thrill. Where is the thrill? Actually, we get thrill this in the aortic area. Aortic area means right upper sternal edge, the upper right upper second intercostal space. In the right upper second intercostal space, usually we get thrill, and thrill may be found all over the precordium, especially in case of severe aortic stenosis. And this thrill may be radiated in the upwards along the carotid artery, in the line of the carotid artery, or in the neck. We may get thrill in the right side of the neck, even on the neck also, and all the throughout the whole precordium we can get a thrill. But thrill is best actually best felt in the aortic area. So the on palpation and on auscultation, usually we get there is a ejection systolic murmur. What type of murmur? This is ejection systole. What type of murmur? First, this systolic murmur, because during systole, blood is ejected from the left ventricle into the aorta through the stenosed aortic valve. So there will be a turbulence of the blood flow through the stenosed aortic valve in systole. So we get systolic murmur in the aortic, especially in the aortic area, but we may get this murmur throughout the whole precordium, but best heard in the left right upper sternal edge, that is the aortic area. And there may be radiation, and this radiation is usually along the carotid artery, that is, it may be found in the neck also. The radiation may be found in the right side of the neck especially, and may be found also the left side of the neck. So this is the radiation and of a aortic patient with aortic stenosis murmur. So this is actually this. What are the other characteristics of this murmur? At first, the murmur is the ejection systolic murmur, number one. The number two, the best heart in the patient is the sitting posture. This best heart in the sitting posture and leaning forwards, and breath holding expiration. So on the left side of murmur, usually we best heart, breath holding expiration, and this murmur is usually best heart when patient in the sitting posture and leaning forwards. So in the leaning, so in the sitting posture with leaning forwards, this murmur is actually best heart. Along with there is a radiation, and the radiation is along the neck. So these are the characteristics of the murmur with aortic stenosis, and these are the actually physical findings. And what are the laboratory investigations that may suggest or that may help in the diagnosis of the aortic stenosis? So on ECG, usually we get left ventricular features of left ventricular hypertrophy, as there is a obstruction of the blood flow through the stenosed aortic valve from the left ventricle to the aorta. So there will be pressure overload on the left ventricle. So left ventricle becomes hypertrophy day by day. So there is increased left ventricular mass. So on ECG, we may get left ventricular features of left ventricular hypertrophy. With maybe find a repulsion abnormalities also. And on a chest X-ray, what are the findings? Usually chest X-ray may be normal, or in chest X-ray we can get there may be cardiomegaly, and if there is usually if associated with aortic regurgitation, or there is a left ventricular hypertrophy, in that case left ventricular hypertrophy, we can get cardiomegaly. And what are the other investigations? Usually, I have said that echocardiogram with Doppler study, and this echocardiogram with Doppler study is the gold standard investigation for diagnosis and a case of valvular heart disease, especially aortic stenosis or aortic, any type of valvular heart disease, by echocardiography, we can see the diagnosis of type of valvular heart disease. There may be some association, that is if it is stenotic type or regurgitation type, if stenotic type associated with regurgitation or not, and we can also measure the severity of the stenosis or severity of the regurgitation also. And by diagnosis of the severity of the stenosis or regurgitation, actually will decide what is the actual treatment this patient will need. It may be due to intervention, or patient may need only medical treatment, or patient may need surgical treatment also. So which type of treatment a patient needs, that depends on the severity of the valvular involvement. And this severity usually we detect by the echocardiography with color Doppler study. So by echocardiography color Doppler study, usually we detect what are the findings usually we get. Usually we get that is the aortic valve area. We can measure, that is the gradient across the aortic valve from the outer to the left ventricle. We can measure the gradient, and by measuring the gradient and by Doppler study and color flow, we can also detect the severity of the aortic stenosis. And depending on the severity, then we and also morphology of the pathology, morphology of the pathological morphology of the aortic valve, we usually decide to what type of treatment this patient should get. So what are the modalities of treatment with a patient with aortic stenosis? Usually patient may need only medical treatment if the patient has got mild to moderate aortic stenosis, and if patient is not symptomatic, or patient symptom released by taking medications, so in that cases patient only need medical treatment. So what are the medical treatment usually we may give to a patient with aortic stenosis? So in case of aortic stenosis, as there is a patient may experience chest pain or exertion, and patient may experience shortness of breath on exertion, or patient may go into syncopal attack, or patient may have experienced some types of arrhythmia also. So beta blocker is the drug of choice in that cases with a patient with aortic stenosis. So if a patient with having aortic stenosis, what medication usually we advocated? Usually we advocate beta blocker. And if a patient this cause of this aortic stenosis due to rheumatic heart disease, then lifelong rheumatic prophylaxis should be given. And also patient should given infective endocarditis prophylaxis if any procedure is done and the patient is risky for infective endocarditis, or this procedure can lead to the development of the infective endocarditis, or there is a chance of developing infective endocarditis. So actually in that cases we advocated infective endocarditis prophylaxis. So these are the actually three important medications, that is will give beta blocker to a case of aortic stenosis. Number two, will give a lifelong rheumatic fever prophylaxis if patient because of this aortic stenosis, the underlying cause is due to rheumatic heart disease. And in case of different interventions that may increase the chance of developing infective endocarditis, in that cases we usually do infective endocarditis prophylaxis. So these are the most important three modalities of medical treatment usually we offer to a patient with aortic stenosis. And what are the other modalities of treatment if a patient present with moderate to severe aortic stenosis and patient is symptomatic, like patient has got shortness of breath on exertion, or patient give history of syncopal attack, or patient give history of chest pain on exertion with aortic stenosis, moderate or severe, then we usually offer this patient with intervention treatment or surgical treatment. So if a patient has got only aortic stenosis and no aortic regurgitation, then we may offer this patient to intervention treatment. Intervention treatment in case of TAVI, that is this TAVI is usually intervention treatment, that is this can be done in the through transfemoral route. So through transfemoral route, usually we change this valve, aortic valve, by artificial valve, that is TAVI. And in some cases, when the patient aortic valve, aortic stenosis is associated with aortic agitation, or valve condition is severely deformed or damaged, in that case, usually we send this patient to surgery for valve replacement, like aortic valve replacement. And this aortic valve replacement, aortic valve may be metallic, or this aortic valve may be biological valve. So depending on the indication or criteria, usually metallic valve or biological valve, which type is needed to a patient, actually decided by the surgeon. So these are actually the mode of treatment of a patient with aortic stenosis. So from the case age of presentation of a case of aortic stenosis with the type of presentation, how the patient presents with a case of aortic stenosis, and what are the physical findings we will get with a patient with aortic stenosis, and what are the ECG, echocardiography, and chest X-ray findings of a patient of echocardiography, and what are the treatment management of a patient of aortic stenosis I have discussed actually from this case report. So, and this is the another case report. In some cases, patient may have multiple valvular heart disease. That is, patient may have aortic stenosis. Patient may have mitral valvular disease or tricuspid valvular disease, or patient may have aortic stenosis with aortic agitation, or patient may have aortic regurgitation or mitral stenosis, or in different ways there may be combinations of multiple valvular heart disease. So if I discussed with a patient with multiple valvular heart disease, that is a 53 years old gentleman presented with shortness of breath and exertion for last 2 years, increase in intensity for last 3 months. So here we also shortness of breath and exertion is the commonest cause of presentation of the way of presentation of a case of valvular heart disease. So this thing we should always remember, that what is the commonest way of presentation of a patient with valvular heart disease. So that is the shortness of breath. So shortness of breath is the commonest way of presentation of a patient with valvular heart disease. And on examination, patient is dyspneic, pulse 128, but irregular, BP 100 bar, 30 millimeter mercury, diastolic thrill apex. That means diastolic thrill means this patient in this apical area, mitral area. So patient may be associated with mitral stenosis. And early diastolic murmur in the left lower sternal area. And these early diastolic murmur, you all know that aortic regurgitation murmur is the but early diastolic murmur in the left lower sternal area. And there is systolic murmur in the aortic area, that is aortic area and systolic murmur is due to the aortic stenosis. And ECG shows atrial fibrillation, chest PAV shows cardiomegaly, echocardiogram shows severe mitral stenosis. What is the diagnosis? The severe mitral stenosis with moderate aortic stenosis, with severe aortic regurgitation, with moderate pulmonary hypertension. So in that cases, usually we refer the case to the surgeon, and what surgeon usually do? Surgeon usually do a double valve replacement, that is replacement of the mitral valve as well as replacement of the aortic valve, as there is a double valve involvement and double valve pathology, and she is doing well. So, so a patient with aortic stenosis also present with, along with acute regurgitation, or patient may present with other valvular heart disease, especially mitral valve. As I have already said in the first lecture of valvular heart disease, that rheumatic heart disease usually involves the different valves, and in case of valvular pathology, usually we see that mitral valve is the commonest valvular heart disease. Mitral valvular heart disease is the commonest, then aortic valvular heart disease, and then tricuspid valvular heart disease, and the rarest is the pulmonary valvular heart disease. So there may be different combinations of the different types of valve disease involvement. Here we see that in the if we go some basic on the aortic valve, there is like a aortic valve is the tricuspid valve. We will see that this is in the diastole, and in the diastole, in the close to the all three cups. This is the cups, and this is the in the opening position in the aortic valve, and in the this is the opening of the aortic valve in the actually in the systole. So this is the diastole closed form, and the systole is the opening form. And what we see here, there is a 3 commissures, and there is 3 sinuses. This there is 3 sinuses. We all know that supported by fibrous annulus. What is the area of the aortic valve? Usually 3 to 4 centimeters square. This is the normal mitral aortic valve area. This is 3 to 4 centimeters square. And here you also see that this is the semilunar valve. This is the aortic valve. This is the sinuses. Here this is the sinuses, and from the sinuses usually the coronary artery arises. From the coronary artery arises from the aortic sinuses. And this is the pulmonary valve. This is the aortic valve, and this is the mitral valve. This is the tricuspid valve, and this is the actual relation of the different types of valves of the heart. And here is also this shows the relation of the different valves, like this is the tricuspid valves, this is the mitral valves, this is the pulmonary valve, this is the aortic valve. So my pulmonary valve lies in front, then aortic valve, and the tricuspid valve and mitral valve lies behind. And this is the mitral valve, this is the pulmonary valve, this is the aortic valve. From the aortic sinuses, the coronary artery. These are the coronary artery. This coronary artery arises from the aortic sinuses. And these are the aortic sinuses. This is the in the diastolic form that when the aortic valve closed, and this is the opening in the systolic valve, and these are the origin of the coronary arteries from the sinuses. And these are the so what are the parts of the heart valve? These are the annulus, commissures, chordae tendineae, and papillary muscles. But these are actually tricuspid or mitral valve. Papillary muscles is usually absent in case of aortic and pulmonary valves. So if we discuss the causes of valvular heart disease in general, there is some congenital cause of heart disease. There are some rheumatic cause. There is some infectious like bacterial endocarditis, and there may be due to ischemic heart disease like damage of the heart muscle or papillary muscle, and there is a weakening supporting structure of the heart that may lead to the development of the especially regurgitant type of valvular heart disease. And we already discussed that if a patient present with valvular heart disease or shortness of breath, in that case, it's usually take the detailed history of the patient. We did usually do physical examination, ECG, chest X-ray, echocardiography, and sub-invasive evaluation like CT angiogram or MRI or coronary angiogram may be needed to diagnose a case of aortic valvular heart disease or any type of valvular heart disease. These are the investigations, these are the way of evaluation of a patient with coming shortness of breath with valvular heart disease. And the order of the presentations we have already discussed. There is shortness of breath on exertion, the commonest presentation. Patient may present with syncope, or patient may present with chest pain or exertion, or patient may present with some complications like heart failure or infective endocarditis, or patient may present with also palpitations. And so are the different causes of aortic stenosis actually. And these are the actually classification of the types of aortic stenosis. Patient may have normal valve area like 3 to 4 centimeters square, I have already said, and the patient may have mitral aortic stenosis if the area is more than 1.5 centimeter area, that is aortic valve area is more than 1.5 centimeter. This is mild aortic stenosis. If patient have aortic valve area 1 to 1.5 centimeters square, this is moderate aortic stenosis. If the patient has aortic valve area less than 0.8 to 1.6, that is less than 1 centimeter area, then it is severe aortic stenosis. So by this aortic valve area measurement, that is area on the depending on the aortic valve area, we divided the aortic stenosis in the 3 groups: it's mild, moderate, and severe. And depending on the aortic valve severity, on that depending on the mitral aortic valve gradient. This mean, or depending on the mean gradient, if gradient is less than 20, then it is mild. If the gradient is 20 to 39 millimeter mercury, then it's moderate. And if it is more than 40, it is severe. And it is if more than 60, then it is very severe. That is my mitral valve gradient. How mitral valve gradient usually we measure? We measure the mitral valve gradient. Aortic valve gradient. How aortic valve gradient usually measure? we measure aortic valve gradient by color Doppler study. By Doppler study, usually we measure the mean gradient of the aortic valve. So there may be mild, moderate, severe, or very severe. So depending on the depending on the severity of the gradients, or depending on the gradient, usually we divided by mild, moderate, severe, and very severe. So depending on the location of the pathology, aortic stenosis may be valvular is the most common causes, maybe subvalvular or supravalvular. Usually some congenital causes, we usually see that there is a supravalvular membrane or subvalvular membrane. So this is the pathophysiology. What are the complications usually a patient may have with aortic stenosis? If a patient having aortic stenosis and this gradient, this area of the aortic valve is increasing by, so there will be severity of the aortic stenosis, and with the severity of the aortic stenosis, patient symptoms may be severe, and presentation also may be severe, and patient eventually may have a left ventricular hypertrophy, left ventricular failure, or patient may have developed some infective endocarditis also. Even there will be ischemic heart disease, and patient may complain of chest pain also. So these are the presentation. Already I have discussed bigastric aortic valve, supravalvular membrane, subvalvular membrane. Already I have discussed it. And our treatment is all the valve, and these are the some tissue valves. These are usually done for aortic valve replacement, AVR, this surgical replacement. So actually, for undergraduate, what I have just told or discussed today, this is enough to learn about the aortic stenosis. And I think if there is a questions, or if you have any questions, you may ask. আমার সাথে কেউ আছো? So if you don't have any questions, then for today we can end here, and in the next class inshallah we'll discuss about the aortic graduation.